virus or bacteria. Produce antibodies that fight and destroy the germ before you become unwell. Do you remember the blue immunization card all Jamaicans received at birth? The National Expanded Program on Immunization, EPI, was one of the country's flagship programs. This program has been the backbone of preventative primary healthcare services. EPI was established in Jamaica in 1977 and has contributed to the reduction in infant mortality and the epidemiologic transition of diseases. National coverage levels for the basic childhood vaccines are generally over 90%. Specifically, polio was eradicated in 1982, endemic measles transition was interrupted in 1991, and rubella circulation was interrupted in 2000. Today, the benefits of immunization are increasingly being extended to adolescents and adults, providing protection against life-threatening diseases that occur in adulthood. Here's a little history of vaccines in Jamaica. Among children from birth to 11 months, 93% received the BCG vaccine, 93% the third dose of the polio vaccine, 93% the third dose of the diphtheria pertussis tetanus DPT vaccine, 93% hepatitis B vaccines, 93% Haemophilus influenza type B. For children 12 to 23 months, 95% received the first measles, mumps, and rubella vaccine, and 95% received the second dose of MMR. What is herd immunity? Remember Balding's paper?
No.
Good morning and welcome to the banquet hall here at Jamaica House in Kingston, Jamaica, for the Prime Minister's Vaccination Town Hall. My name is Naomi Francis. This morning, Prime Minister Andrew Holness will host this Vaccination Town Hall to educate the public, to hear your views as well, for us to understand in a comprehensive way what's going on really with the COVID-19 vaccination plan, and to allay some of your fears concerning vaccination. With the Prime Minister this morning is a very esteemed panel. We have with, of course, Prime Minister the Most Honourable Andrew Holness. From his far left is Professor, the Honourable Denise Eldemaya Shearer, no stranger at all to us, especially for those in the aging population. Professor Eldemaya Shearer is a Professor of Public Health and Aging at the University of the West Indies, Mona. We also have with Professor Shearer, to her right, Professor, the Honourable Peter Figueroa, no stranger to Jamaica at all. Back in my early days, Professor Figueroa was the country's epidemiologist, and certainly a very, very distinguished professor in terms of public health, and of course in HIV/AIDS, the work that he did as well. And of course we have Dr. Melody Ennis, the Director of Family Services at the Ministry of Health and Wellness. And of course, thank you, our viewers, for joining us this morning in this virtual town hall. Already on the Prime Minister's Facebook platform, we have 570 persons. Am I seeing? No, I beg your pardon, 585 persons watching. And of course, we're streaming live on JIS, PBCJ, and all of the Prime Minister's pages. So thank you so much for joining us this morning. And let me now hand over to Prime Minister, the Most Honourable Andrew Holness.
Thank you, Naomi, and thank you all for watching. Vaccination is not new to Jamaica. And I would go back to my own experience with vaccination. I recall at primary school when the national vaccination programs were being done. Of course, my greatest fear at the time was not the vaccine, it was the needle. But we all got vaccinated. And we are all still here today, and the better for it. So the fears of vaccination, I believe, especially given the situation with this pandemic, are to a large degree unfounded because we have our own history to rely on. And indeed, with new births in the island, it is our public health requirement that they are vaccinated for various diseases. And that goes on almost on a daily basis. And we do go back to the clinics for vaccination for booster shots. So vaccination is not new to us, and it is a part of our public health, and we keep doing it. And we have had no significant or concerning adverse event from vaccination. So I wanted to start from that point, that everyone who is listening, and you could speak to your friends and your family members to cast their minds back to their own experience with vaccinations. Now, since that period of time when we had massive vaccination programs for polio and other forms of diseases, the science behind the development of the various vaccines would have improved tremendously. And not just the science, but the regulatory environment would have also improved. So the science has got much better, and the regulatory oversight, both in terms of the medical professional oversight and the governmental oversight, has gotten much better. What has also improved would be the government's ability to actually organize and deliver vaccine. And even in the 60s and the 70s, when we were doing it, we did it quite well. Certainly the older members on the platform would be able to speak to that. But from what I've been told in my discussions, we did an excellent job in delivering vaccines right across the country. So the fear that some would have in our society, the hesitance and the reluctance, while it is your right to be skeptical on anything, but you also should bear that right and balance it against the public good that you do in taking the vaccine. Because the vaccines work, yes, on an individual basis. If I take the vaccine, then I personally am safe from the disease. But if I'm the only one that takes the vaccine, it doesn't really do any public good because the disease, the virus, is still around and still infecting. And indeed, though I am vaccinated and I may not get ill, I could still carry the virus. So it is important that a large percentage of the population, we would want everyone to take the vaccine, barring those who would have any special circumstances that could create complications. But we would want a large percentage of the country to take the vaccine, and that is the public good element of it. So yes, you want to take the vaccine for your personal safety, but you also want to take the vaccine for the public good safety. And the public good is the benefit of all of us. So if I'm vaccinated, and you are vaccinated, and you are vaccinated, business can go on, parties can go on. And if that is not a good reason to take the vaccine for some people, then I don't know. Right? But parties can go on if you take the vaccine. So from a public good perspective, the recovery of the country is dependent upon the take-up of the vaccine. What we're seeing so far in terms of the results, and which is of concern to me, is that the people who are clamoring to take the vaccine and who are turning up in large numbers are usually those from a higher income category. And I'm treading carefully on the subject because vaccine politics is a real issue, and the social divide in the country is easily stirred up. But it is something that we have to talk about. Why is it that higher income people are more willing to take the vaccine? It is usually because of information. They do more research, they have more access to information, and many of them speak to their doctors directly, and so they get advice. Persons who live in inner city areas or in rural areas do not always have the information and don't always have first-hand access to their doctors and practitioners to give them the advice. Now, that could be a danger for us. And of course, they would also get access to perverse information saying, don't take this vaccine or don't do this. And though that kind of information is being circulated widely in our country, people who are opinion leaders, people who are influential in various areas, whether it is church or music or entertainment, they are sometimes messengers of perverse information. And so they don't have a context within which to understand why they should take the vaccine. So one of the reasons we're having this conversation this morning is to reach out to persons who are in our rural communities, in our inner city communities, that you need to get vaccinated. All right? We want to see you turn up at the vaccination centers according to the published priority lists. Now, let me go quickly to that. The supply of vaccines right now is slow, and I would use the term uncertain. But we are getting flows, so we will have vaccines available. And we have started the program, and we expect to be able to continue the program right through without any breaks. What it means is that the supply of vaccines in the first few months of the program will be far less than the demand for the vaccine. So even though there is hesitancy and reluctance in the society, we still have enough persons who want the vaccine. And what we're seeing happening for people who want the vaccine are people who have more knowledge about the vaccine, people who have more access to doctors who can guide them. And that is not going to result in an equitable distribution of the vaccine. So the government has a duty to reach out to those persons who are in marginal areas, people who are in inner city communities, people who don't have access. We have to reach out to you and get to you directly to encourage you to take the vaccine. Because during this period of short supply, what will happen is that a certain section of the society will get vaccinated, and they will be able to go back and move around without having that high risk of infection, whilst people who are poorer may very well still maintain a high risk of infection, and that's not good for our society. So the appeal is definitely to get everyone vaccinated. Now, let's talk about how we distribute the vaccine. The first order of business, and I'm not a professional in these matters, so I stand to be corrected, but since I'm in flight in speech, I will go on to say that you would really want your most vulnerable demographic. And those, of course, would be persons who are most at risk of the most extreme adverse effect of being infected, death. So the persons who are most at risk of dying, you would want to get those first. The statistics are showing that the most at risk would be those persons 60 and over. And so you would want to get that demographic first. You would also want to get your healthcare workers vaccinated first, because that gives certainty to the continuation of medical treatment and care, and it takes the stress off the health system. And the health system, as it stands now, is under extreme stress. We have to protect our doctors and nurses and all the other adjunct services in the health field, because if they go down, that's it. So from a practical standpoint, we must get the healthcare workers vaccinated. Now we know that there is a concerning level of hesitancy amongst the healthcare workers, and we would encourage them to take it. My recent conversation with Dr. Ennis suggests that they have gotten over it, and you're having quite a improvement in take-up. But we expect that that will improve as more persons are vaccinated, and the demonstration effect shows that it is safe. Already around the world, I've just confirmed with Professor Figueroa that over 350 million persons have been vaccinated. Some countries have already attained herd immunity in terms of the level of vaccination, and some countries are well on their way. Small countries like Jamaica are definitely well behind that. We still have a long way to go. To date, we have only vaccinated about 17,000 persons, and we hope to increase that. And here I should break to say thanks to the government and people of India for their kind gift of 50,000 vaccines. It is a great demonstration of South-South cooperation and solidarity, and we are ever grateful to the people of India. And special thanks to Prime Minister Modi for considering Jamaica and other countries in the Caribbean to give us our first supply so we can start. We have also gotten some supplies from the COVAX facility, and we expect to get more supplies, maybe in small numbers, but still enough to keep us going, from other platforms on which we are participating. So generally, the message is the vaccine is safe. Get vaccinated. It is important for your personal health. It is important for the public good, meaning that if we reach this herd immunity level of vaccination, we can go back to normalcy, open our economy, and party and church can keep.
Thank you so much, Prime Minister, for that opening. Very comprehensive, too. And you mentioned two things. This is really to ensure that we're doing our part to educate the public, a part of the public education drive. But importantly, too, that this process of vaccination is evidence-based, that we're going based on what the literature says, what the evidence has also produced in terms of who gets vaccinated, and two, just the level of professionalism that we put into that program as well. Before we get to the doctors on the platform as well, they're very, very creative Jamaicans, among us, and we happen to have an animated video that was produced based on what the literature says about vaccination. So we ask our viewers to take a look.
Infectious diseases were constant terror during the 1800s. Diseases of all varieties exacted a horrendous toll on the world. Periodic epidemics and pandemics swept across the globe, killing millions, rivaling the horrors of world wars. A Harvard Liberty publication by Ben Baldwin entitled "Mandatory Vaccination: Why We Still Got to Get Folks to Take Their Shots" says that Jenner's smallpox vaccine led to the research and development of vaccines for otherwise widespread and epidemic diseases. Vaccines have immeasurably improved our quality of life. They have led to the eradication of deadly diseases like smallpox and the near elimination of diseases such as diphtheria, polio, and measles. Balding states that vaccination is widely considered one of the greatest medical achievements of modern civilization. Childhood diseases that were commonplace less than a generation ago are now increasingly rare because of vaccines. What is vaccination? In essence, vaccines can prevent infectious diseases that once killed or harmed many infants, children, and adults. How do vaccines work? Vaccines work with your body's natural defense to build protection. When vaccinated, your immune system is able to recognize the invading germ. An example is a virus or bacteria. Produce antibodies that fight and destroy the germ before you become unwell. Do you remember the blue immunization card all Jamaicans received at birth? The National Expanded Program on Immunization, EPI, was one of the country's flagship programs. This program has been the backbone of preventative primary healthcare services. EPI was established in Jamaica in 1977 and has contributed to the reduction in infant mortality and the epidemiologic transition of diseases. National coverage levels for the basic childhood vaccines are generally over 90%. Specifically, polio was eradicated in 1982, endemic measles transition was interrupted in 1991, and rubella circulation was interrupted in 2000. Today, the benefits of immunization are increasingly being extended to adolescents and adults, providing protection against life-threatening diseases that occur in adulthood. Here's a little history of vaccines in Jamaica. Among children from birth to 11 months, 93% received the BCG vaccine, 93% the third dose of the polio vaccine, 93% the third dose of the diphtheria pertussis tetanus DPT vaccine, 93% hepatitis B vaccines, 93% Haemophilus influenza type B. For children 12 to 23 months, 95% received the first measles, mumps, and rubella vaccine, and 95% received the second dose of MMR. What is herd immunity? Remember Balding's paper? Well, he states that in order to be effective at eliminating communicable diseases, vaccines must be administered to sufficient levels of persons in the community. This leads to what is called herd immunity. Herd immunity, or community immunity, is when a large part of the population of an area is immune to a specific disease. In order to achieve herd immunity, the government of Jamaica estimates that at least 65% of the population would have to be vaccinated. COVID-19 has infected millions of people and killed over 2.5 million worldwide. Here in Jamaica, the number of infected persons keep growing, and so too has the death toll. The pandemic has had a deleterious impact on our economy, the education of our children, our healthcare infrastructure, and our very way of life. No sector has been left unscathed. The good news is that vaccines are now available. The question many people have, however, is, should I take the vaccine? Countries have already begun to vaccinate their population, and Prime Minister Holness has given the following assurance. Jamaica has successfully administered vaccines over the years. We're making sure that the vaccines we have are approved by the World Health Organization. We're making sure that the vaccines are distributed and administered very quickly. So what does life after COVID-19 look like? We know the measures outlined under the Disaster Risk Management Act have disrupted lives and livelihoods. They have caused tremendous fatigue, and people just want to get back to their lives. They want to go to the beach. They want to make a supermarket run at 1 a.m. in the morning. They want to stop wearing masks. They want to hug their relatives. They want to travel freely. To put it simply, people want to return to normal. The vaccine will enable us to do this.
So that's a very, very interesting take. And I start, Prime Minister and panelists, with the last question. People really just want to get back to what they deem as normal. But we're now living in a new norm, really. May I, Prime Minister, with your permission, because you are the host here, go then to Professor Eldemaya Shera in terms of looking at what the normal that we experienced before COVID is, and the new normal now, and what really people can practically expect, with vaccination?
Thank you very much, Naomi. Thank you, PM. Throughout the pandemic and very early, we began to focus on older persons, recognizing that they needed to be a focus of prevention. That has had some success. We see, especially in residential facilities, both public and private, that the number of cases are low. We also see, we do have 350,000 older people across Jamaica. And if you look at the rates of infection, they are not at 40 and 50%, which is what is being seen in other countries. We're still at about 16% among older people. However, the death rate among older people is high. 71% of deaths are in the over 60 population. And if you look at the increasing, the 5-year bans, you will find that it increases to the over 80s, where it's over 25%. This has led to fear. You ask, what was it before? What is it now? Older people are listening to the stay-at-home order. All you have to do is drive on the streets and see it. All you have to do is go to our doctor's offices. They're missing appointments. All you have to do is see the rush on some of the vaccination centers. They are afraid of getting COVID. And so vaccination for them, in fact for the population, is the final step. We will never get rid, I don't think, of masks and sanitizing for a long time. I think wherever we are for the next few years. There was a report earlier this week that it could be seasonal. So I think it's very important. And I want to add to the Prime Minister, who talked about parties, and he did mention church. I think for most older people, they want to hug a grandchild. They want to get out and they want to have Sunday dinner. So I think this is what is important. The risk factors that have been identified worldwide, Jamaica is no different, are the comorbidities. 72% of Jamaica's elderly have at least one comorbidity, hypertension and diabetes in particular. And therefore, there was a question, do I take it? Yes, you take it. You have to take it. You are in the risk group. You take your medications as normal, and you just go about life. In the new normal, which is isolation, looking forward to what's at the end of 10 weeks after all of this starts. And I just would like to join the PM in appealing to all our seniors. We need to ensure that it's seniors from every area of Jamaica that come out to be vaccinated.
Prof, because yes, there is sometimes questions that people would have and reservations, and I'm happy that you've encapsulated those comments as you have. Professor Figueroa, your take really on vaccination. You've been the country's chief epidemiologist for years, while you were at the Ministry of Health, and now certainly in private practice and at the university. You have a lot to say as well on that.
Yeah, well, good morning all. I think the Prime Minister was right in reminding us about the importance of childhood vaccination. I have been practicing medicine and public health since the 1970s. And in the 1970s and 1980s, many of the childhood diseases that are now prevented by vaccination were very common. We would have outbreaks of measles in which thousands of children would get ill, many would die, and now we do not see this at all. Many people do not realize that Jamaica and the Caribbean was the region that led the world in eliminating common childhood diseases that were preventable by vaccines. Now, these vaccines, many of them that we're giving the children now, and is keeping them healthy, come from the same manufacturer in India, the Serum Institute, that produces the AstraZeneca vaccine that we're using in Jamaica to prevent us getting ill from COVID. If we look globally, we know that millions of people have become ill with COVID and many have died. In France right now, the French doctor reported that every 12 minutes someone is being admitted to intensive care unit due to COVID, severe COVID. So this is a disease that we have to take seriously. Many people, it is true, luckily, the majority of persons who get COVID may have some symptoms, some have no symptoms at all, especially if you're young. But if you are older, then as many as 1 out of 6 who gets COVID, who is over 70 years of age, is likely to die. And if you're over 80 years of age, then 1 out of 4 may die. So our best hope to control this epidemic is the vaccine. Now, I have the privilege of being on the World Health Organization working group that is reviewing all the vaccines that have been prepared to protect people against COVID. We've looked at this vaccine, the AstraZeneca vaccine. The World Health Organization has approved it as highly effective and safe. Now, what each person really needs to think about is that we do have a risk of getting COVID, and a family member has a risk of getting COVID. How can we prevent this? Certainly, by wearing a mask, as we are doing this morning, helps to reduce the risk of infection, maintaining physical distance, especially indoors. But the best way is to take the vaccine, because what that does is, once you get 1 dose of the vaccine, within a few weeks, your body is responding to that vaccine so that you're developing protection against COVID. And even 1 dose can protect you from severe COVID. Of course, it is better to get 2 doses of this vaccine, 8 to 12 weeks apart, and you're almost certain to be protected from getting severe COVID, and therefore you will not end up in intensive care unit. These vaccines are superb. Now, I know there is a concern among many persons, how did they make the vaccine so quickly? But what many people do not realize is that they were trying to produce a vaccine against the coronavirus from after the 2003 SARS epidemic in China. So from that time, they've been working, how do we get a vaccine against the spike protein of this coronavirus? So when we had the COVID outbreak and the Chinese managed to sequence the genetic code of the coronavirus, which causes COVID, this virus is a cousin of the SARS coronavirus. So what they were able to do is the vaccine that they were trying to prepare against SARS, they simply adjusted it to address the difference in the genetic code, so that when you get an injection in your arm, it goes into the muscle, and the vaccine just enables you to produce a protein which mimics the protein of the spike protein of the coronavirus. Your body recognizes that and develops immunity or protection against those proteins. So that when you're exposed to the COVID virus, the body recognizes it and immediately controls it. It's extremely safe. There was a question recently in Europe where there was a concern about blood clots, but I can tell you the majority of persons who develop COVID and have to be admitted to hospital, you have to put them on anticoagulants in order to prevent them from developing blood clots. So when the regulatory organism, the regulatory body, the European Medicine Agency, investigated this problem, they found that overall there were fewer blood clots in persons who had received the vaccine than what they would normally expect in the population, because people developing clots happens all the time. But they actually found overall there was fewer blood clot formation in those who were vaccinated. However, nevertheless, they said we have to be alert. So they say, let's put out a warning to the physicians and put it in the pamphlet to persons being vaccinated. They could not rule out a risk that there may be blood clots, so let's be alert for it. But that potential risk is approximately 1 out of 1,000,000. Whereas if you're elderly, if you're over 60, maybe 1 out of 10, 1 out of 20 is at serious risk of hospitalization. So my word, it's understandable for some people to be hesitant. I say let's vaccinate those who are ready, and as we vaccinate more persons, others will see that the vaccine is safe. The most you get is a little local reaction, a little fever, headache, maybe for a day or two. That's just your body responding to the vaccine. So this is a very good vaccine, and it can help us to control the epidemic and get us back to normal.
Thank you so much, Professor Figueroa. I ensure that we took the time to hear every single word and syllable that you said, because it's so important for us to sometimes listen in silence. There's a lot of noise surrounding the vaccination and a lot of uninformed persons who are out there giving information. And here you are, right at, as your grandmother, as my grandmother would say, really, you get it from the horse's mouth, that this is the professor from Jamaica who sits on the panel with the WHO to look at these vaccines and its efficacy. And it's important too that Professor Figueroa spoke, because there is an ecosystem within the research and medical profession that ensures that we get vaccinations right, so that each person may react differently to a vaccine, but what you want to ensure, as I heard you said, Professor, is that we keep the levels to a minimum in terms of those who have adverse reactions. But each person would react differently, but the majority certainly it would be good for. May I welcome those who are joining from Nationwide Radio. Already we have more than quadrupled our listenership and viewership, so it's tens of thousands watching, listening, and also having questions. I have some already. There is a chemo patient who is asking as well, is it safe for me as a chemo patient to get the vaccine, and when? She didn't just say if, but she said when. So let's get to that question. I don't know if Dr. Ennis could take that in her opening remarks as well to us. Good morning, Doc. If you could as well, Doc, focus a little bit for us on the younger population, the children and teenagers and young adults as well, who may be susceptible to COVID-19, and the importance for them as well to take the vaccine.
So good morning, everyone. Thank you so much. So the impact of the COVID-19 pandemic has not spared young persons at all. However, what is absolutely different is how they respond. And we have been tracking what's been happening since last year, March. And young persons are asymptomatic for the most part. They don't show any signs and symptoms. a slight cough maybe, they don't even think that anything is wrong, and therefore they go about their normal business. And that is true for Jamaica as well. Now, we spoke earlier about the robustness of our program in Jamaica. And indeed, it has been so well that there is a generation or two that don't know the impact of the devastating diseases such as polio and measles and tetanus. That generation is unfamiliar, and therefore the urgency to take a vaccine is certainly not there, because they simply don't know. And that is not just, it's for all young persons, including medical professionals and nursing professionals, healthcare providers at this time. So we want to ensure that persons recall that vaccines have been around for a while and they have prevented serious illnesses. We can go back, and it's not too far back, because if we go back just to the 1950s, persons who had polio were placed in iron lungs. They were unable to breathe on their own for life. And these persons, some of these persons are still indeed alive. So we certainly don't want to get back to that stage, definitely. Therefore, we must continue with our vaccination program, not just for COVID, but for all the vaccine-preventable diseases. But as we come back to COVID now and what's happening to our young persons, because their impact is not palpable to them, then it is difficult for them to not be fatigued with the wearing of masks, the social distancing or physical distancing, and certainly the hand washing that is absolutely critical. And what has been happening here in country is now we have community spread. And this community spread is very serious because our hospitals certainly cannot manage. And it's not that persons are having COVID and not being treated. It's that persons with any and every condition that requires hospitalization may not get treated because we are simply bursting at the seams. So there must now be something that can stem, that can stop, that can curtail, that can just ease the pressure really on what is happening. And we are at the point where we turn to what is known, tried and proven over the years for a preventable disease, and we go to the vaccine. So we currently have the AstraZeneca vaccine in country, and it's supply and demand. We certainly at the Ministry of Health and Wellness intend to vaccinate absolutely everyone. However, we are in the climate of supply and demand, and the demand across the world is indeed great. In spite of the hesitancy, the demand is indeed great. And therefore, we have prioritized, and the groupings that we have started with. We're not vaccinating children. No, we're not, because they weren't a part of the clinical trials. So as we vaccinate older persons with comorbid conditions, we have to continue to preach the message to our children, to our younger persons. We've got to wear our masks, we've got to do the hand wash, and we've got to physically distance until we have vaccinated enough persons in the population so that we have attained herd immunity.
All right, wonderful. Thank you so much, Doc. So let me get to a couple of the questions online. And Prime Minister, even before we started, so many persons had questions in terms of when can they get vaccinated as well. So I think there really has been a 180 or close to a 180 where people are, more and more getting the information to make an educated decision and are asking more and more for the vaccine. So the first question from Yvette, she's a chemo patient and she's asking if there would be any adverse reaction to chemo patients if they take it, and when. She didn't just say if, but she already wired her mind to when can she get her vaccine. Doc. Yes.
Persons who are immunocompromised or on immunosuppressive therapy do fare worse when they get the COVID-19 disease. And it has been the recommendation that these persons do indeed take the vaccine. But we have to look at the current status of each patient who is possibly so ill. So it is a conversation to be had with your physician as to your current robust status. So if you are well, you are not having a flare at this time, then yes, you ought to take the vaccine. If, I'm not sure how old Yvette is, Lady Yvette, if you are over 75, then next week is your time. If you are not, then the other week or the other week. But we're coming to you. And you have a comorbidity, then therefore you are definitely on our priority listing. So I want to encourage you to continue to build your immune system, eat right, certainly get some sun in the day, a lot of sleep, so that when it's your turn, your system will be ready to accept the vaccine.
Thank you so much, Doc. Prime Minister and doctors, professors, I have a question from Claudette Cunningham, who's asking if persons with lupus, especially those over 60, would be able to be considered in the vulnerable group.
Yes, certainly someone with lupus should get the vaccine because that's someone with a comorbidity. If they get COVID, they're at risk of having more serious attack of COVID. So as long as they're not having an acute flare-up, then they should get the vaccine. If they're having an acute flare-up of their lupus, as soon as it is controlled, is reasonably controlled, they should get the vaccine.
Wonderful. I have another one again. I like the fact that so many people are, ensuring that they're listening and attuning it to their own issues. I have one from Tenzi Sunny, who's asking, why are special need adults not in phase 1 of the vulnerable population? For example, individuals with Down syndrome are 5 times more likely, according to this person, to be hospitalized, and they could end up in hospitals, yes, from COVID more than the general population. Dr. Ennis?
So we continue to look closely at the evidence internationally, but we also look at our own local data. We look at our hospitalizations for these persons with special needs. And indeed, they have vulnerabilities to quite a lot of diseases, but we have not noticed a significant increase in the numbers of these persons having COVID, or not only having, but faring worse than the older persons, for example, and healthcare workers who are more exposed. And therefore, they did not fall in the priority group. However, the Ministry of Health and Wellness is making special preparations for these persons to be vaccinated as we get more vaccines in country.
Thank you so much. Prime Minister, there is a notation from several persons online who are asking if you'd be able to go over that priority list, the national list that we've come up with.
Certainly, I'll allow Dr. Ennis to do that.
Wonderful. Before we do that, though, because I think we also have the graphic on it that Minister Tufton had outlined in that press conference, there are a few more, and I'll allow epidemiologist Professor Figueroa to deal with a couple of these. I'm sorry, I'm not seeing the name. If I have an underlying condition and get COVID, can I get the vaccine? And can I get the vaccine if I'm now sick with COVID-19?
Yeah. If someone is sick with COVID currently, then we do not advise them to take the vaccine while they're ill. After they recover, they are going to develop immunity and protection to getting infected again. So usually we say wait 4 to 6 months, since we know that people will have immunity for at least 6 months. So we say allow someone else, since there's such a problem with the number of doses available, allow someone else to get vaccinated, and they could wait 4 to 6 months. But if they have recovered and they do take the vaccine, no harm will come to them. In fact, that will act as a booster to their immune system, so they'll be even more protected than before.
Wonderful. There's also a follow-up to that, and the question is, how long really does this vaccine last? And I've seen about 3 or 4 persons, and the questions are coming in very fast, so my apologies if I'm not seeing all of your questions or asking them. They really are coming in very, very fast. Thank you for that. But a follow-up to that, Prof, is how long really does this vaccination last?
Well, we already know it lasts several months, but we don't know how long it will last. For instance, the flu vaccine often lasts only a year. You have to then get another flu vaccine the following year. We are hoping that the COVID vaccine will last longer than that. Maybe you will need a booster in a year or 2 years or 3 years. That is still to be determined, but we do know that the vaccine is good, so we are optimistic that it will give you protection for a good while. The one little question that we do have is, because we are seeing new variants of the vaccine, of the virus, new variants of the virus, will a new variant be able to infect someone who was previously vaccinated? But so far, the current vaccines appear robust against the current variants.
Thank you so much, Prof. Doc, yes, if you could then go over for us the schedule we have in terms of the segments of the population that we will be offering the vaccination to, and the timeline, if you could.
So we are beginning to mop up at this time our healthcare workers, which we started on the 10th of March. So we started with healthcare workers, and as we proceeded through the days, we added persons from the Jamaica Defense Force, persons from the Jamaica Constabulary Force. So the last week and a half into 2 weeks were dedicated solely to these persons. Of course, a few elderly persons would have been included in that. However, as we move into next week, our main focus will be on persons over the age of 75. And in between looking at persons over the age of 75, we'll also have a focus on persons in our infirmaries, persons in our nursing homes, who of course are also by and large elderly persons. Once we complete those persons over 75, we will move in, and we're hoping that we'll be able to do that in another week and a half to 2 weeks, that we'll complete that grouping, and then we'll move to persons between the ages of 60 and 70 with comorbid conditions, and we will include persons of the Jamaica Fire Brigade will come into that grouping. And as we go on, and we are hoping that we will get more vaccines come April, first week in April, second week in April, then we will continue our program, extending it to persons in the education sector, for example. Now, in between all of this came or will come our parliamentarians and members of the executive. We started, of course, with those who are elderly, over 60, and move through until we get that entire group done. So we have a schedule that will take us to the close to the end of April with the vaccines that we have in stock at this time.
And then following that grouping, the general population.
And we gradually get into the general population. Of course, it's going to be older ones with comorbidities before we go to those without comorbidities.
All right, fantastic. Doc, I have a question here from one of our social media persons, Kim, that says, if I'm the only person in my family taking the vaccine, will that protect the entire family?
The vaccine will protect you from severe illness, possible hospitalization, and even death. And that is why we go right back to our IPC measures, because your family need to also remain in their bubble that is safe, and you will need to continue wearing your mask. So will everybody in the family. Do the hand wash thing, sanitize, and physical distance as appropriate. Remember, if you are in a family, then you're in a relatively safe space. And if all persons are adhering to these protocols, then it gives you a little leeway within that family setting. But remember, no strangers coming in, not too much outdoor activity, etc.
Wonderful, thank you. Let's go to Professor Figueroa. Very important question that someone is asking. So you get 2 doses. The vaccine we have, the AstraZeneca, is 2 doses. I believe it's 8 weeks following. Now, Ricardo on Facebook is asking, can someone catch COVID having gotten the first vaccine in between getting the second one?
After you get your first dose, it takes a few weeks, about 3 or 4 weeks, before your body has produced sufficient protection to reduce your risk of COVID. So if you get exposed in the week or the second week after your first dose, you could still get COVID. But once you've had 3 to 4 weeks after the first dose, the risk of getting COVID is much, much less. After you get the second dose, 7 days after the second dose, you are fully protected. And therefore, it is rare to get COVID after you have 2 doses, 7 days after the second dose.
Very good. Thank you so much, Prof. Let's go back to Dr. Ennis. Boy, I think the questions are coming fast and furious. So let's then turn to the female population. Getting a question, what can pregnant women take the vaccine?
So the AstraZeneca vaccine at this time is being offered to pregnant and lactating women in the healthcare sector. So if you're a healthcare provider, then that's the recommendation. But we need to explain that just a bit. So in clinical trials, pregnant women as well as children are not usually looked at all. It is until vaccines and other medications have passed through the phases and is now in the general population where thousands of persons get the medication that we then turn our attention to looking at trials in children and pregnant women. So we don't have a lot of data, but what we do know is the characteristics of this vaccine that we're talking about. It's non-replicating, which means that this vaccine will not cross over into the placenta, and therefore the fetus is protected. This vaccine will also not get into breast milk, and therefore the baby is protected from getting any ill effect of the vaccine. So we have the science of the vaccine that it is safe. And we also now know that healthcare workers in the reproductive age range, if they get the disease, they do so much worse. Not only do they themselves do badly, but they tend to have premature babies. So when you look at that risk benefit, then the risk of getting the vaccine, because it is safe, we know it's not getting into the placenta, not going into breast milk, and we look at the impact of the disease on these very exposed persons, then we adhere to the recommendation of the Strategic Advisory Group that healthcare workers should be offered. But as we get more information, then the vaccine may be offered to the entire population, the entire pregnant and lactating population, but not at this time.
Thank you so much, Doc. Then let's go to Professor Scherer, because I do have some questions coming in from those over 60. So Ms. Vi is asking, if I have comorbidities and I'm over 65, I'm guessing that Ms. Vi is over 65, should I take the vaccine before or after my regular medication?
You will, thanks, Ms. Vi, you will take the vaccine when you get your appointment, and you will take your medications at the time that you normally do. Most people take it in the morning, certainly after breakfast or something, but you do have people that take it in the evening. So stick to your regular regime for your medications and keep your appointment for your vaccine.
You know, it's a very good point that Ms. Vi raises, because, Prof, I remember when I was certainly growing up, and even now, there are people who believe that it's best if you take vaccinations early in the morning. Is there really such a thing? If you take it, if you take it in the morning, it's better for you, or is there, you can take it any time?
You can take it at any time, but there's another concern with older population. A lot of the medications, especially the hypertensive medications, send you to the bathroom. And a lot of older people do not take their medication when they're going out, whether it's to the health center and to get a vaccine. It will be okay if you don't take your medication because that's your normal practice, because you don't want to get caught on the bus or something. But take it as you would when you come home.
Thank you, Prof. So, Prime Minister and panelists, you know, I think there are a lot of people who really appreciate the fact that we're having this very candid discussion. I have a question who says, the person says, don't bother call the name, but really, the question is, does the vaccine affect sperm count for men? Prof.
I doubt it very much. I don't think that has been tested, but I think we can reassure that person, don't worry about that. This is a vaccine that may save their life, so bear that in mind.
Very good, thank you. Listen, I just asked about the questions, and the persons who don't want me to call their names, then that's fine. But let me then ask another one. For women, is there any, especially for those in the, you know, fertile population, you know, young women, and no issue at all either?
A lot of women have been included in the trials, so thousands of women have already got the vaccine, and we're seeing no ill effect at all. And we are confident that over time, as we get more experience, because some women who have got the vaccine are now pregnant and they're being followed, we are confident that the vaccine will probably be safe even among pregnant women as well. And as Dr. Melody said, that the health workers, they are being vaccinated. In some countries, they're even vaccinating pregnant women. But it's an individual decision.
Yes.
You know, so some would prefer not, but if a woman really wants to be vaccinated, I wouldn't withhold it.
Wonderful. Thank you, Prof. Phyllis Sutherland has no issue with us saying it's Phyllis asking this question. She makes a comment, then asks, many persons who say they will not be taking the vaccine are now cutting the line to get the vaccine. I'm over 65 and I need my vaccine. Phyllis says, when and where do I go? But Phyllis didn't say exactly where she is. But Doc, if you could again just point out those over 65, when is their time? Those who are quite normal. Phyllis didn't say that she had any comorbidities. I beg your pardon.
Okay, so we're getting to everybody. Slowly but surely, we're getting to everyone, starting with over 75. However, we intend to leave no one behind, and therefore, there are several avenues that are now open or will be open on Monday to ensure that persons can register. So you can register using the web-based system, electronic medium for vaccination appointments. But not to worry, if you are not savvy with the technology, that's okay. You can call your health department. If you are already in the public sector, we would know because you attend our curative services, and we have a list of those persons to be placed on our appointment schedule. We also have engaged our private practitioners. So if you're not in the public system and you're visiting your private doctor, you would have given your name and particulars, so you will get an appointment as well. The Ministry of Health and Wellness have also engaged the BPO. So if you don't have anybody and you just need to call, you can call somewhere and someone will be able to schedule your appointment for you. So we're trying our very best that all persons will have access to be able to get an appointment and certainly be vaccinated once our supplies increase.
Thank you for that, Doc. PM, there are some questions here for you concerning the issue of, how confident are we that we'll have enough vaccines? Before you come in, though, PM, I just wanted to pick up Dr. Ennis on this issue, because recently we heard that there are some missing vaccines, 1 vial of missing vaccines, maybe 10, but significant when we have a short supply already. Doc, if you could walk the public through, is it that we give them that vaccination card as well, so you don't just go and get vaccinated and there's no record of your vaccination?
Absolutely not. So there is a record of absolutely everything, actually. So we verify whoever is to get the vaccine utilizing a national ID or TRN number, etc. So I know that it's Melody Ennis to get the vaccine. I also will receive a card. But on that card, we have all the particulars. We have the manufacturer, the batch number of the vaccine, and we have the signature of the personnel that administered the vaccine. So that is a standard record, and you have it, and we also keep a record of that for ourselves. Now, when we dispatch vaccines, it's from the central stores into our parishes, and then into the distant sites until it gets into each person's arm. So we really have a line listing of who should get the vaccine on the day being inoculated. But as you know, things happen. So a vial might fall and break, and we have some wastage. Or, as in this case, 1 vial, which contains 10 doses, went missing. An audit has been commissioned, and we are awaiting the results of that audit. And as soon as that information is known to us, I'm sure our Minister of Health and our PM will advise the nation about that 1 vial that inadvertently left us.
Well, Dr. Ennis, I take that 1 vial so seriously, because if we don't step on it from now, that 1 vial, as we go through the vaccination process, could turn into hundreds. And in a scarce public good such as a vaccine, we have to ensure that it is managed with the highest level of integrity and probity. Because the history of the distribution of public goods in Jamaica is not one in which we can say that it has been done with great probity and transparency and security. And we as a government, we are intent on breaking that cycle of the improper distribution of scarce public goods. So we take it very seriously, and I've had word with the Minister of Health, and we're going to go with the fullest force to find out what happened to that vaccine, and if there is any negligence, malfeasance, or deliberate theft and corruption involved in it, even for 1 vial, there will be prosecution. So I want it to be absolutely clear to the Jamaican public, and indeed to all who are administering the vaccine, that the government takes this very seriously. And all the more reason because it was a gift that we have to show to the people who have given us the vaccine, obviously, that we respect their gift and we're using it in the appropriate way. So having said that, the whole process of accessing the vaccines depends on, 1, the availability of the vaccines. And as it stands now, vaccines are not widely and generally available. The production and distribution of the vaccine that is being done directly from manufacturers to government. So the vaccines are not in this phase available for private sector distribution. And what that means is that governments that certainly have a large resource base and governments who have production capacity resident in their country or within their economic union, those countries tended to have gotten access first. And so richer countries have been able to stockpile and put reserve on production capacity even before countries like Jamaica. So from a practical point of view, the manufacturers might be resident in certain countries. Those governments are going to immediately try and get the vaccination. Now, there are global initiatives which recognize that this would have happened and have tried to create facilities through which countries like Jamaica would be able to get access to vaccine. One such is the COVAX facility. And what they do is to amalgamate purchases, so we also get the benefit of volume purchase. And the benefit of volume purchase is not just for countries like Jamaica to get a stable price, but manufacturers need to know what the demand is going to be so that they can plan. So it helps to stabilize the market for vaccines. Now, we have gotten our very first supply from the COVAX facility, and we are the first in the region to get, and that's just 14,400. And that's a very small number relative to our population, which we will have to give two vaccines, 2 doses. So what I want the public to be aware of is that the global market dynamics for vaccines at this time will not allow for large flows. And it is likely that we will get flows, but they will be small flows, enough to keep our vaccination program going. And we probably, with the effort that we are making, we probably will get one large supply. And then from that one large supply, we will try to do what we are calling a blitz, which is a mass vaccination in quick and short order. Now, we are also pursuing, outside of the multilateral approach, which is to participate in COVAX and in the African Medical Supply Platform, we're also pursuing bilateral negotiations, as we did with India, with other countries that may have supply. And what they have indicated, and this is just the nature of things, and Jamaica, like all other countries, have to accept this, that before they give vaccines or allow us access to vaccine, they will have to reach a certain threshold in their population first. So there are countries that we have approached that have said, hey, we are friends, we want to help you, but we have to do our population first. And we have a saying in Jamaica, pass and christen and picnic fuss, right? And that is just the way of things, and we have to accept that. So eventually, countries will reach this critical threshold. Already, countries, the United States is moving very quickly. United Kingdom is moving very quickly. I'm reading that Israel has reached their herd immunity threshold. And other countries are moving rapidly. So you're going to find by June, that's my target, that there is almost an equalization of demand and supply in the market. And so we'll have greater access. Our strategic objective now is to pursue very diligently our commercial negotiations, that is between government and producers, pursue our multilateral arrangements, which are already set and established, that is with COVAX and the African Medical Supply Platform, and pursue bilateral arrangements with even more intensity. And that should increase our small supplies, even if we don't increase the size of the supply, but certainly the regularity of the supply. And once we have that, then we should be able to rapidly expand the delivery of the vaccine. So people, may not understand why I've taken this approach of emphasizing the fairness and integrity of the distribution. Because presently, the supply that we have in Jamaica will be relatively small to the demand that currently exists. If there is any wastage of the vaccine and there is a break in supply which temporarily halts the program, the government and the country will be exposed to criticisms. I needed the vaccine, but you take it and give it to somebody else who didn't need it. So, it's very important that the country has faith and trust and confidence, not only in the safety of the vaccine, but in the equitable, safe, and efficient nature of the distribution of the vaccine. And we are working very hard to ensure that it is done in that way.
Prime Minister, thank you for that, because that really reassures persons in terms of that equitable and fair distribution process that you speak of. Time flies when you're learning a lot and you're having fun learning a lot. I have a few more for you, though, and I'll allow the panel to give a 1-minute wrap-up as well. But there are two questions that I really had to almost have you work the response from Dr. Ennis and yourself, PM, in terms of right now the government is doing the rollout of the vaccination, and there are some private sector people who may say, well, we can offer vaccines too. What is the government doing about that? Because that is very important, especially when you have to have your card to do that, and the government is making sure that the process is fair and equitable.
So the common view is that why not have the private sector do it too? The policy of this government...
Meaning individual medical doctors and
the private
medical
sector,
centers.
as opposed to the public health system.
Yes.
Currently, private doctors administer vaccines to children. They do. So we do have the capacity to do that. And eventually, I think that will become the case. However, there are a few things that we have to understand. One, it is the scarcity of the supply. Once you introduce pricing as a means of rationing how the vaccine is distributed, then what it means is that people who can afford the price will get it, and those who can't won't. And that is not good for social stability in especially a country like Jamaica. I don't know of any country now that has, in the early phase of the distribution of the vaccine, put a price on the distribution of the vaccine. And we couldn't do that here in Jamaica because, again, the question of equitable distribution is very important. So that will not happen in the first phases of the vaccine, eventually, when vaccines become widely. The second issue is to ensure proper regulation, right? We need to be able, with certainty, that the persons, that we have captured the information of the persons who got the vaccine, and be able, at very short notice, with, if anything went wrong, especially in terms of the batches and how they are distributed. So tracking is important. So right now, it is better to be able to track the vaccine through central administration. But outside of that, I think our doctors are experienced and capable, and it is something that we do all the time. But just for the pandemic and the management of the pandemic, it is best that in the first phase, it is done centrally and through the public health system without charge.
May I ask the forgiveness of the viewers, especially on social media? We have several questions. We have to wrap up in about 3 or 4 minutes. And so I'll allow the panel to just give a closing comment. If I could then squeeze in maybe 3 or 4, and then the panelists could also possibly deal with it in their closing remarks. One person is asking about the homeless and mentally ill. When are they scheduled to get it? Because they also do interact a lot with the public as well. And the provisions for seniors who are not able to leave home, I think Dr. Ennis will be able to take it. And finally, Prime Minister, may I put this one to you as well. For those who travel overseas and are vaccinated, come back to Jamaica, what's the protocol? Is there a changing protocol that will come? Is Cabinet also revisiting that kind of protocol process?
Dr. Ennis, you want me to go first on that?
Yes,
the protocols still remain as they are. We will eventually examine new protocols when we feel we have started to have wider distribution of the vaccines and so forth, but the protocols remain as they are.
We'll allow you to do your closing, but let's go from Professor Shearer and then come around, and the Prime Minister, of course, will end.
Two quick things, Naomi, just to also point out, because it may have come up in an answer given, because it has come up with us as well, who have some seniors, especially seniors over 75 do not have a TRN, and any government ID, so we're using passports, not all seniors have a TRN, and again, nobody will be denied because of that. Even before you get to Dr. Ennis, the issue of mentally ill persons has been very high on our agenda, as not just mentally ill, but also the homeless. So we have been making contact with the agencies who know where these people are and who they trust, because there's a trust issue here. So there are some agencies, Salvation Army, that feed them. There's National Council for Drug Abuse that has surveys. So they are, whereas we cannot say exactly how they are going to be done, they have certainly factored into the conversation. And the issue of seniors who are unable for various reasons, and there's two groups. There's those that are physically impaired, and there are also those that are mentally impaired that would be very disruptive staying within a center. And we have given consideration, so persons will stay in a car and somebody will go out to them. But you see, we have to do the observation, we have to do all of the other things that everybody has spoken to. But yes, so these things are being taken into consideration as we seek to vaccinate, which for me is a very critical population.
Thank you so much, Prof. Professor Figueroa.
Yeah, I'd just like to thank and commend all my colleagues who are working in the health service, those particularly who are in the hospital and who are so hard pressed right now given the surge. They're really highly committed and dedicated, and we have to support them and ensure that they are looked after. And I would encourage all of them to get vaccinated, because this will protect them from becoming infected. Our health staff in the field are also working very, very hard. And it's now about a year since our health workers have just been working around the clock responding to this epidemic. So I'd just like to state my appreciation for them, and a way that all of us can help them and help ourselves is by, when our opportunity comes up to get the vaccine, to take that opportunity. This vaccine is highly effective and it is safe. Those of you who do still have hesitation or concern, talk to someone who is informed, your family practitioner, your clinic doctor, or seek a credible source. You have to be careful what you read on the internet, so seek a credible source to get your information. But I would like to assure you that this is a safe vaccine that could save your life or that of a family member or friend.
Thank you so much, Prof. Dr. Ennis.
Thank you so much. The baton has been passed. The baton continues with the journey. We are now into the second leg, and we have the vaccines. We don't have the supplies that we want, but we're getting there. slow and steady, so all persons can be vaccinated and we leave no one behind. I just want to remind all of us that if we're tempted, Honorable Prime Minister, for getting vaccines being missed inadvertently, I want to really say that, recall, vaccines must be maintained at a particular temperature. The vial is no good after a certain period of time. So when our vaccines go missing, it's not benefiting anyone because you have broken the efficacy of same and you won't be protected. So let's stick to the system. Let's have it work for us because it is a robust system. It is well oiled. We have committed, dedicated personnel who are eager, although tired, eager to vaccinate. I want to also lend my commendations to all healthcare workers who have done what is almost impossible over the last year, the sacrifices of their families. So, you know, we praise the healthcare workers, but we need to remember the families who are suffering because they are not at home for long periods of time. So it is indeed commendable of the healthcare staff and all the support services. But we can't give up at this time. We're not slowing down. We're just moving into another gear. It's going to be a long haul that's going to take us maybe a year and a half. So we're asking that the country, all of our people, support us. When it's time to be vaccinated, let's do it in the orderly manner that we can. Let's make ourselves, our entire country proud of just us accepting the vaccine and doing it the way we know we should. And remember, we're trying our very best to ensure that no one is left behind.
Thank you so much, Dr. Ennis. And Prime Minister, thank you for having the foresight to ensure that our population is fully educated about this and hosting the first town hall on COVID-19 vaccination. And so your closing remarks.
This is the first of many that we will have to host.
Indeed.
And I want to join with the doctors on the platform in really paying our respect and saying thanks to the healthcare workers, doctors and nurses and our field officers, the public health officers who are doing the contact tracing and the surveillance. There is a massive logistics operation going on behind the scenes. The public doesn't see it because it comes across almost seamlessly. But there is a huge logistics and organization and administrative effort behind the scenes. And so the staff at the Ministry of Health, the police and the military who work to have all of this done, we say thanks to them for their sacrifice and commitment to the country. My final word on this matter is get vaccinated. Take the vaccine. Right. After that, as pointed out by Professor Figueroa, that after your second dose, then you should have a very high level of immunity. And when we have reached that critical herd immunity threshold, then, and probably shortly before that, we could then start to remove some of the restrictions. I'm just trying to prepare the minds of the country as well, that in France, you mentioned France earlier, Professor Figueroa, that they have gone into another phase of lockdown. Yes. And there are other countries around the world, and they're doing their vaccination still. We are not out of the woods. This is the beginning of the end. It is not the end. We are right there now, where if we behave responsibly, personally responsible, and as a community responsible, then we can bring the end of this pandemic earlier. We can get to the end earlier. If we are reluctant, uncooperative, if we listen to perverse information, if people who are information opinion leaders decide to go out there and spew nonsense into the public domain and people follow it, then we prolong the pandemic. Right? This is not new. We have done this before, many decades before. But you know what? We become victims of our own success. We don't understand the fear and trepidation that existed with polio and measles and how people then reacted and took the vaccine. We don't have that anymore. And so we feel that, well, let somebody else take it, and then by some miracle, everybody else is going to get better. That's not how it works. Right? We all have to be committed to take the vaccine. And I again appeal to those persons who have the public ear, who have a microphone in front of them, who have the ability to communicate with the public far better than I do, and who have the trust of and following of a large section of the population. Use your influence in the right way. Get people on board to wear their mask, social distance, sanitize, stay at home if they are ill, respect the curfew hours, respect the other protocols that are in place, and when your turn comes, which will be publicized in terms of the order of priority, then go and get vaccinated. Right? We must exercise a great deal of responsibility for our destiny as a people. And that is how we will, together as one family, recover stronger, better, faster, fairer, and more sustainable.
Thank you so much, Prime Minister, of course, taking from your theme in the budget debate yesterday. Thank you so much to our viewers on social media and to those joining us on Radio Nationwide 90 FM. It was our pleasure bringing it to you. Thank you to Prime Minister the Most Honourable Andrew Holness, Professor the Honourable Peter Figueroa, Professor the Honourable Denise Eldemaya-Shera, and Dr. Melody Ennis. Of course, the Prime Minister said this is the first of many. Stay tuned for more coming your way. Thank you so much. Have a good morning.